Hello everyone, in our last video we were talking about the sensory and psychomotor functioning that changes during the late adulthood, and we focused our discussion on vision and hearing loss and the vision and hearing impairment in particular. So now let us understand the taste and smell that gets impaired during a late adulthood, and then also we'll focus on strength, endurance, balance and reaction time. That is altogether one point: strength, endurance, balance and reaction time. And then comes the sexual functioning. So this ends your first chunk of unit 4, that is late adulthood. So taste and smell. What you taste often depends on what you smell. So when you could smell something really nice, then you would definitely have an idea of what flavors this particular dish would contain. So when we spoke about this taste and smell during our middle adulthood, we said that things that your father could taste well, your mother could taste well, and your father might find faults in it, and he might complain to you that this is not accurate as to the mark it used to be, and you feel that it is all fine, why is he saying this? So at the same time, when mom cooks and when she gets to hear these comments, she would definitely not pleased with such kind of comments. So the taste buds do change, do vary, and there is a gender difference. Men do lose their tasting ability much earlier than the females do. So female have much ability to sustain with the taste buds when compared to men. So that is the understanding that we had in a middle adulthood, and now focusing the same concept in the later adulthood, how these changes takes place. So let us look into that. When we lose both these ability, that is ability to taste and to smell as well, and we are not able to find why, and this can be due to various other things, like medications can also be the cause. The medication might reduce your ability to taste and smell accurately the way you used to, and the diseases that you are exposed to, that can also rise the risk of it, and these can be changed with the surgery. If you have problem with your olfactory tract, then that can also undergo surgery, and this can help you regain your senses back. When older people complain that food does not taste good anymore, it may be because they have fewer taste buds. So in the earlier, when we are dating this same concept to the middle adulthood, we can say that there the individual's taste bud was under impairment, it was undergoing the impairment, so that when he or she approaches the late adulthood, then their taste bud itself is lost. So that was a progress towards aging. So they have very few taste buds because of the taste receptors are not working properly. They may or also maybe because the olfactory bulb, the organ in which the brain is responsible for, organ in the brain which is responsible to sense the smell, it is also not functioning, or it might have been damaged. That can also be the reason for an individual to lose his ability to taste and smell. Sensitivity to sour, sweet and bitter flavors may be affected more than the sensitivity to sweetness. So when we are growing old, only taste sense that comes along with us is the sweetness, the taste of sweetness, not the taste of sour or bitter or say salty. So we all will have the ability to taste and sense the sweetness rather than the other tastes that we used to enjoy thoroughly in our young adults or the middle adulthood. So now let us move on to understand strength, endurance and balance and reaction time. So totally 4 of the phenomena that takes place during the later adulthood. So when we talk about that, older people have less strength than they once had and are limited in activities requiring endurance or the ability to carry heavy loads. We spoke about this in the initial stages while we introduced ourselves to the topic of the physical and the systemic changes that takes place inside the body of an individual who is aging. So this is what how an individual is approaching his old age. He loses his ability to lift the loads, heavy loads, and adults generally lose the ability to function in accurate manner, just like carrying on the heavy loads and heavy objects for about 10 to 20% of their strength by the age they reach 70. So by the time they reach 70, their ability to pick up on the heavy loads is lost for about 10 to 20% of generally what they are able to do. That is one of the statistically defined phenomena. And then the muscle of a lower body, and more than that, the walking endurance declines more consistently with age, especially among women, than some other aspects of fitness such as flexibility. So among women, if we talk about women body, we can make out that their ability to walk, ability to move around, or the fitness of the muscle is lost when compared to the flexibility. So we also had this understanding in our middle adulthood when we said that women require more calcium content than men, and the body of women requires as the more absorption is not being done, so extra supplements has to be given for women than men, because bones are fragile when compared to the bones of men. So the same thing has resulted in this as well. That aspect, that understanding from a middle adulthood will help us understand that the muscle tone of a lower body, especially among women, is reduced as they age or approach the later adulthood. But the flexibility remains better among women. These losses may be largely reversible. However, in controlled studies with people in their 60s to 90s, weight training, power training, or resistance training program lasting 8 weeks or 2 years increased muscle strength, size and mobility, speed, endurance, and leg muscle power, and spontaneous physical activity. So the studies done say that under a controlled condition, to a controlled group where the 8 weeks muscle training program was done, so this can help people regain their ability, their muscle tone, their ability to function as normal as they used to. All these things are it can be cultivated, it can be done if the proper care and proper training is given to the individual. So this study says that you just can't resort to the feeling that I'm aging and I'm losing my muscle tone. It's all natural. I can't do anything about it. I can't help myself with this. So you can't just sit back. So there are chances to reverse these disabilities or impairment that takes place as we age by taking good care of ourselves and by indulging ourselves in the activities that could help us in strengthening all these muscles and the body strengthening activities. So this is one of the understanding that we need to keep in mind as we age. This evidence of plasticity, the evidence of plasticity and modifiability of performance is especially important because people whose muscle have atrophied are more likely to suffer falls and fractures and need help with tasks of day-to-day living. One reason for old adults' susceptibility to fall is reduced sensitivity to the receptor cells that give brain formation about the body's position in space. Information needed to maintain the balance. Slower reflexes and impaired depth perceptions also contribute to loss of balance. So there are many things that results in the individual's body that makes him lose his balance, the ability to withstand properly. At times while walking they might roll down and fall, or they just collapse just because of various things, that the slower reflexes, the ability of the reflexes also reduces as we age. Older adults may find it harder than younger adults to recover when they lose their balance. So even when we are walking, at times we may also fall, but then we are able to balance ourselves. We are able to catch hold of some other things which is next to us, so that it will prevent us from falling. But then their ability to do that is very less, and many falls and fractures are preventable by boosting So many fractures and falls can be preventable by boosting muscle strength, and balance and gait speed. So when we are able to do this, when the exercises that are very much helpful in gaining the muscle strength could be done and should be taken care in an intact manner, then definitely we can avoid all this situation in our life. And exercise designed to improve balance can restore body control and postural ability. The traditional Chinese practice of Tai Chi is especially effective in maintaining balance, strength and aerobic capacity. So the various studies done on this geriatric psychology, or say the aging, people who are aging, the geriatric studies that tells us that as people age, there are many factors which has to be taken care of, and their life is changing physiologically in this way. How the aids from outside could be helpful to prevent all those malfunctioning or impairments, and how we can replace the negative life of an individual with the positive terms, and or by giving the positive feed in, so as that they can function as a normal individuals, just like they used to do during their middle adulthood. If that is the case, the various studies have taken place. So these studies give us ideas, the interventions, and how the ability of an individual can be regained or improvised by various factors. So one of the famous therapy, that is a traditional practice by Chinese, that is Tai Chi, can improve your ability to maintain your body balance and strength and the aerobic capacity. So this tells us that the endurance, muscle strength, balance and reaction time could be taken into consideration. The reaction time is one where when you are falling in your young adulthood or middle adulthood, you are able to catch hold of things. Your reflex is good, but then when you age, your reflexes slow down. The slowness of reflex makes you fall, and if you can sustain that by providing good exercise, good muscle toning, muscle managing, muscle strengthening activity, then definitely you can avoid many fractures and falls in your old adulthood or the later adulthood. So these things are very much clear. So just with the idea that I'm growing old and this is the phenomena that is taking place and it's natural and I can't do anything about it, this ideology is not at all good. So to make this ideology subside, we have to work on ourselves from the middle adulthood, so that we can avoid most of the old age problems and be a person of functional aging. So these things are very much important for an individual in his daily lifestyle routine. We need to make this as a part and parcel of our life, so as to be a functional older adult in later life. So this sums up the balance, strength, endurance of an individual. Now moving on to understand the sexual function. When we talk about sexual functioning, even in our middle adulthood, we were talking about that. We had a focus on menopause and climax in the middle adulthood. How the individual's sexual ability to reproduce is sterilized, how they are no more able to reproduce their young one. We also had understanding that the sexual functioning remains constant till the end of their life. So but then at time there might be some other sexual dysfunctions, like there might be infectious problem in the sexual apparatus. There can be other issues, like when an individual is stressed out and overly involved in his professional life, or overly indulged in taking care of his family, or designing a good life for the family members, then he might overrule out the interest in sexual functioning. Then this might reduce the sexual interest, and stress and strains also leads to the decreased sexual interest. These things we had a look in our previous chapter. Same way here, individuals are retired by the age they reach 60-65. So they are much more into themselves and their partners. Here the problem is the sexuality, the functioning of sexual organs are continue to be the same. The sexual interest is not diminishing. Here the diminish is caused due to other factors, just like health problems, and there are chances that most of the time people reach this age, they might not have partners. Women, though they continue to hold the same sexual desire the way they used to have during their middle adulthood, same sexual desire is continued in their later adulthood. Even then, to function out their sexual desires, they might not have the partner, because women, as we referred to the earlier section, where women live longer than men, so this is where they are mostly widowed and they are partnerless during this point of time. And when we talk about the functioning of the sexual organs, they grow slower as the individual age, so they do not function in the accurate manner the way they used to function. So the erection and ejaculation requires more time in men, and the lubrication of the vagina is also requires more time, and artificial lubrication also has to be taken place so as to carry out the sexual intercourse. But then other than that, the expression of it is not hampered. So the medical practitioners has to take a good care of this, as few of the medicines prescribed during the older age or the late adulthood at times hampers the sexual functioning. They have to make sure that the patient to whom they are administering these medication are aware of the side effects or the effects of those medications which they are taking, so that they can make out why things are not functioning right in their life. So if few things change in the lives, then that can hamper the psychology and the understanding of the people around them. So both the physiology has its impact on the psychology again. So this can cause many other kind of problem in the life of an individual. So he or she should be aware of the effects of the medication that is being administered on them, and how this is affecting their sexual life or the sexual functioning of that particular individual has to be very much clearly understood by the patient himself, and the responsibility of doctors to make sure that the patients are aware of it. So this sums up your understanding about the psycho and sensory motor functioning, psychosensory motor functioning of an individual during their later adulthood. So this ends up the first chunk of Unit 4. So in our next videos, we will move on to understand the cognitive development that takes place during the later adulthood. Thank you.